I love Ellis because the people are amazing. Both the people you work with, the people you treat, the administration is really supportive. And every day I come into work knowing that I'm going to be able to do good things for people. One of the really secrets of emergency medicine, the best experiences in emergency medicine are often found in the places that you would not have heard of in residency.
You know, this area is really a hidden gem. Schenectady is close to the Adirondacks, is close to the Catskills, close to Boston and the city, so for a good work-life balance.
You get to come to a place where you're going to get a higher pay rate. You're going to get a higher quality of life. You owe it to yourself to check it out. I think the thing that separates it the most is the relationships that people have. The culture is really, really good here.
I love the people. I love the APP group. I think it's, you know, the greatest APP group I've worked with in the ER.
The people in leadership really want the best thing for the patients, for the community, and they really try to do their best to make it easy for us to do our job and to act in the best interests of the community.
So we have a new ED that was recently built. We have a robust fast track, super track area right off of our triage.
It has 12 rooms where we could rapidly assess you. You get to see the nurse right away. There's medical staff to greet you immediately. Get your labs drawn, get your medication. So having that physical space allows us to really get people seen as quickly as we can.
All private beds, no hallway beds, which is great for noise reduction and quality of care while patients are in the department.
And even though you're really busy and there's a lot going on, it's quiet. It's a lot calmer than most EDs. We have Care Team 1, and Care Team 1 has a really well-equipped space to do what we call resuscitation, meaning when someone is really sick and they have to be seen immediately, it's very easy for the ambulance to get in, the doctors and the nurse can get to everything really quickly. Everything you need is really at your fingertips, and everyone gets to work together to coordinate care among the team members. We also have a separate ED psychiatry unit called the Crisis Unit, Care Team 5.
Where we see mental health complaints. That is a locked unit that's separate from our medical patients, so that helps with our throughput and patient care.
Things are sectioned off so that it's not chaotic, it's not loud, there's not just people dwelling in a large space. That's an advantage. Something we did last fall is we brought everyone into Care Team 1, in lingo, the doc box, but it's really the Care Team box. So you'll have 2 doctors there. So it's really the nerve center, it's the heartbeat of the ED where we make all the decisions, we coordinate care, and we can really work together to make things happen. Having a group like US ACS that is local, but we're also national in the sense that we have resources, we have tried and true methods, experience to literally hundreds of emergency departments and hundreds of hospitals to problem solve was the big difference. And we were able to get our ED wait times down from like 8 to 10 hours, and our ED turnaround times are much shorter, our times to admission are much shorter. So we're always trying to do a better job, and I think that people will notice that the quality of care is really good. It's a sweet spot in terms of it's big enough to give the support you need. It's small enough that you get a community feel. So here you're gonna have the satisfaction of being able to do things you want to do. You're gonna have the support to do it. So you could work a 12-hour shift here and not feel like you're ripping your hair out or being scared that you're not supported. So when you come with US ACS, you're not alone. That's especially true at Ellis. But having someone who guides you through those high-risk situations, improve your likelihood of having a good outcome for your patient is really important. And I don't think that there's many groups doing this the way that we do it. And then knowing that you have great healthcare coverage that we fund ourselves, knowing that from the get-go, you have ownership. There's no buy-in, there's no maybe we'll take a look at you. No, if you join, you become an owner. I can say that I know by working here and having the 401k that is an industry leader, that I know that I'm gonna be taken care of. I know that my kids are gonna have their college. I know that I don't have to work longer than I want to, both in the short term as a new doc and in the long term. USCCS is unmatched in that respect. I spent 18 years going all up and down the Eastern Seaboard. I didn't have to change a company. I didn't have to lose my retirement. I didn't have to lose my benefits. I was able to have a career long-term with US ACS. So if you want to have a career with us, I think that you could have a really satisfying career if you start at Ellis.